Okay, so working in the region of the abdomen conceptually is no different than working anywhere else. So as we already noted when you were trying this, you're going to really be able to work on the abdominal wall perpendicular to fiber direction. The only abdominal muscle that has clear fiber direction throughout essentially its whole length is the rectus abdominis. The other ones do for some portion, so the internal external oblique, but the TVA, it's deep, it's not that big, and whatever, no big deal. But push-pull across the abdominal wall will be able to show you clear things, as will like a quadrant test or a yield to pressure. Pushing on with no pain, letting go and pain, immediate red flag, that's rebound tenderness. Pushing and having some discomfort that the patient describes or expresses, you'd call that like a yellowish flag. But if it's push, let go, and ouch, that's get out of here, go to ER. I don't know what that is. That's dangerous. Okay. So as I noted, if you're going to do push-pull, you want to make sure you do it on both sides so it's not just dominant, right? So perpendicular to fiber direction, right? So you kind of go in the middle, you'll push across, you'll get a general idea. You'll pull. Now, it might not be clear, right? So to me, and maybe you can see this in the excursion of my hand, when I push, it doesn't look like it's doing as much as when I pull. But I want to know whether or not that's the case. So I have to acknowledge that there's a dominance in my hand posture. So I swing around, and this won't be as visible because you guys will see my back and it'll be obscure. And I'm like Dr. Zoidberg. Right, so again, in the middle. There we go. So interesting. Yeah, sometimes you got to get in the right spot. Would you agree that going this way is a little bit easier than going this way generally? Yeah. It doesn't necessarily feel the same to me because this is on my fingertips now, whereas it's on the heel of my hand, so it's a little funny. And then yield to pressure, your quadrant test. So you kind of match the angle of the ribs. Squishies, squishies. Now obviously when I go over here it's a little bit different, and I can't trust it because of the angle of my forearm. So although some people would teach it from one side, and they'd say, oh, well, you got to get over. Well, when I get over, I have to change the angle of my arm. So the pressure's not the same. So squishy, squishy. This is really annoying because then you actually have to go to both sides. Thank you for not letting me hit your feet. And then you switch hands. Actually. So here-ish? Yeah. So a little higher. So it's all things are pointing me to this side. Right, so it's this side of the abdomen. It's not lateralization. So sit up for a second. Please don't get kicked by the man and face that way. So I don't face this way. So in visceral diagnosis, they'll do what's called lateralization. So they'll just kind of do this, and whichever side they feel pulled to is the side of the visceral dysfunction. So this is where I say it's like the Princess Bride. It's Father guide my sword, right? Now, if I do this, do you think I might get guided to another side? Right? So does this not seem like it would change what I would feel because my posture is now different? Right? So it's a question. I don't know that it does. But anyways, on your back. So we don't do lateralization. We do similar tests in multiple ways to confirm where I think something might be happening. Now, the things that I have to access, either adding tension to the abdominal wall or taking tension away from the abdominal wall, are going to be the ribs, the pelvis, and the leg. The arm's not going to do much. Right? So again, I don't want to assume what's going to do anything. I want to test, right? So I'm just going to move this hand up here a little bit. I'll come in here, and then I can, right? So interestingly, this should take tension away from here, is what you would expect, correct? When I do that, does it feel slightly more uncomfortable, right? Whereas if I was here, it's kind of nothing, right? So what I'm actually going to do is I'm going to switch hands. If I go here, does that start to feel slightly more comfortable, right? Now, bend this leg, the opposite leg, okay? Bring the foot up higher, thanks. That softens it, right? But it feels kind of neutral, is that fair? Yep. Okay, let this down, bend this knee. Now, let's push tension on it, but does it make it feel comfortable, uncomfortable?
Just more tension.
Just more tension. So it doesn't make the area act up. Right? So here's the deal. I get some tension on it. Now, if I compress through here, the tension's still sort of there, but it's comfortable now, right? So the way that I would make the assumption that it's comfortable is because it softens under my hand, right? So in this case, although the ribs are most proximal, they're not doing what I want. This leg on the same side is almost always going to do more of what I want. The ribs on the same side are going to do more of what I want. So generally when working the abdomen, work on the same side. Use the leverage on the same side. Now I'm definitely having to use some muscle. This isn't the best for me, but it's something. Right, so see, it kind of got softer. I used the compression a little bit more and moved it. There we go. So it's again, it's almost always a little bit of this, a little bit of that. Let this down. And I try to keep this about the same pressure. So if I take up any slack with it, I try to keep it the same pressure. That's interesting, right? So it's like nothing, right? So nothing, when I say that, I'm kind of broadly on the side of the pelvis, but when it gives me more of what I want, because I'm going to get a bit more rotation, I bring the heel of my hand up higher, so I'm pushing closer to the ASIS, and it gives me more stuff, right? But that's because I'm paying attention to the resistance that I feel under the palpating hand.
Are you pushing superiorly?
With which hand?
That.
So it's multiple things. So it's not simply superior, right? So I'm not doing this, I'm pushing into it, but I'm molding my hand, right? So look, so you see my hand go this way? That's going to be part of it. Fingers going this way and this way. So you're getting what you need, because if I just do this, somewhat uncomfortable. But if I do this for him, pretty cool. Yeah. Soft. Softer. Not harder, softer. Sorry. Right? So there we go. Now we'll kind of recheck what the ribs do, and if the ribs... So I've got all these mini checkpoints. So if I push into the ribs and it still makes it uncomfortable, maybe it didn't do what I wanted, right? That feels very different. Much nicer to you. Did we just get a gurgle when I let off? Yeah. Don't be surprised by gurgles, right? Like kind of, the berberigme, the blah, 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 blah. That's going to happen. So don't think that anytime you're treating that the blah, 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 blah means anything. So in the case of retesting, I'm going to do this because this is where he was. I'm not going to leave him here because it's a minor difference. I'm going to keep it as close to what I did as possible. To you, this feels a little bit more comfy, right? Yeah. So the test that I really need to recheck now. So that feels a little bit more comfy. So I'm like, okay, mini test on the ribs. That felt better. I'll do my quadrant test. Like I can just drop right in. Yeah. So I could tell you all kinds of stories and say it's the stomach, it's the pancreas, it's the transverse colon. I could say all kinds of stories. I have no idea because I'm really thinking about resistance to motion and finding the stuff that will move, that will allow him to respond in a way that doesn't make him have to protect himself. So that's why when I say it feels uncomfortable, he's more likely to have to protect himself and have to think about it. I don't want him to do that. And then I push in here. It all just feels better. You'd agree with that? Yeah. We've got the positive affirmation. So as with anything else, perpendicular to soft tissue direction, yield to pressure of soft tissues. I want the handles that are going to help me take tension off or put tension on. If I put tension on and it feels like a kickback, that's uncomfortable. I don't want to do it. If I take tension off and it feels uncomfortable, I don't want to do that. I've got to find something else. So initially using the ribs as a handle, which should have worked the best, did not. So I test the opposite leg to show you that the opposite side doesn't do a ton. The same side does way more. I use the leg, it does something. I use the pelvis, it does something. I go back to the ribs eventually, it's way nicer, right? So consistently, instead of assuming what will work and going to the method that has been prescribed, check what's connecting. Check what's taking tension off with no kickback or putting tension on with no kickback. All sounds good?